You know, there's a great quote that I just love from Ben Franklin, and I've heard it used a lot in a lot of different debates. But he said that those who would sacrifice liberty for a little safety and security deserve neither liberty nor security. And it was interesting that in the recent months you heard that tied to quartering soldiers or due process or civil liberties. And that's really not where he got started. This was before the Constitution was written, before the Revolutionary War. He was the finance chairman in Pennsylvania on the state legislature. And there was a group of very wealthy people from the western side of the state who came to that committee and said, we think the people of Philadelphia should pay, for the first time ever, a direct tax to the state to help us in the problem that we have in the western side of the state. Yeah, good idea, he said. And what he was trying to say is, and his whole argument is, that is not fair. You cannot punish those people in the areas of Philadelphia who are working hard and playing by the rules to pay for the few on the other side of the state for something that they should take responsibility for. And it was interesting because that is an ember that lived and burned pretty bright in the whole debate of who we are as the American people. In the most difficult times we've had in this country, we never abandoned the thought that it's okay to punish those who are working and doing the right thing and playing by the rules and take something away from them to give it to somebody else who may or may not do that. We have agreed that a safety net is a good idea. So you think about it. The Great Depression, over 30% unemployment for years. The poverty level in the United States was staggering. But we didn't give up. We didn't say, you know what, it's too hard. The federal government should do it for us. We didn't do that. World War II, when they were rationing sugar and rubber tires, we didn't give up. And that spirit, that ember of fairness on behalf of the American people has led to the greatest nation on the face of the earth. Because it's individuals' responsibility. It's people getting up every day and think, I can do this better, faster, quicker, the speed of business. I can take care of my family. Let the government take care of something else. So now we get to this point. And for years and years, this debate has come up. The federal government has to step in and run your health care. The federal government has to step up and run your health care. And for years and years, once the American people get a chance to look at it, they say, no way in heck. It's not going to happen. That's what you saw in August. It's that same ember that Ben Franklin talked about. It's the same one. And what they found when they read the bill, there was 54 boards and commissions and programs to run their health care, that they had to go into a government plan. Matter of fact, the president said, you can keep your plan if you like it. And if you talk to Americans, they found that pretty offensive. That's like saying, hey, we're the federal government. If you like your dentures, we're going to let you keep it. If you like your children, we're going to let you keep it. Isn't that good of us? They didn't have the right to tell us they could keep something that we earned. So here's what we did. We went through and took line by line of the president's speech. He challenged us to bring us something. Here's one version of it, and it's a step. And it's a culmination of all the work of all these members on the committee who believe passionately that we can make an impact on health care for the better. We can control costs. We can improve access. We can do all those things without the federal government stepping in and controlling 270 million people's worth of health care. They couldn't even get 750,000 transactions right on cash for clunkers. We're still fighting about it. And we're going to take millions and millions of the most personal transactions you do every day in your life and turn it over to the federal government. That's what this bill does. It's in the bill. So what we did, and I'm going to quickly go through just a few of these. Quote from the president's speech to Congress. For those Americans who can't get insurance today because we have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin. Good idea, Mr. President. That's why we have had a bill that expands state high-risk pools that accepts all patients and prohibits plans from imposing coverage gaps. Guess what, federal government? You don't have to be involved between me and my doctor. Problem solved. As one big group, this is the President of the United States, customers will have a greater leverage to bargain with insurance companies for better prices and quality coverage. Mr. President, great idea. That's why, for the work of members on this committee, there's an association of small business plans that allow small businesses, not because the federal government tells them to do it, to get together and negotiate with insurance companies that we today say they can't do. It's against the law.
Gentleman's time has expired.
And Mr. Chairman, if you really believe that the President of the United States was honest about extending a hand, this is your chance, this is this committee's chance to answer these questions in a way that gets millions of Americans covered on health care and doesn't involve the federal government.
Gentleman's time.
And your doctor.